Okay, now let's talk about the somatosensory cortex. This is the part of the cortex that processes somatosensory information. And the primary somatosensory cortex, which is the first part of the brain or of the cortex that gets input from the thalamus, the ventrolateral nucleus, is the primary somatosensory cortex. And the primary somatosensory cortex is located on the post-central gyrus. So this is the post-central gyrus of the cortex. So remember that this groove right here we call the central sulcus, and that divides the frontal lobe of the brain. So this is the frontal lobe from the parietal lobe. So back here is the parietal lobe. And this gyrus that's just posterior to the central sulcus we call the post-central gyrus. And it happens to be where the primary somatosensory cortex is. It also happens to be Brodmann areas 1, 2, and 3. So when Brodmann was numbering these regions, he just happened to start here and called the sort of middle surface of the post-central gyrus area 1, and then area 2 is posterior to that, and then area 3 is anterior. So area 3 is actually the part of the post-central gyrus, which is right next to the central sulcus. But all three of these together form the primary somatosensory cortex. One important property of the primary somatosensory cortex is that it is somatotopic. So this is yet another example of a topographic map. We saw this in the visual system. We talked about it in the auditory system. So in the somatosensory system, when we talk about a topographic map, we're talking about a somatotopic map. That just means that adjacent parts of the body are going to map to adjacent regions of the somatosensory cortex. So, and this is how this map is usually drawn. So this is just a cross section of the brain through a coronal cross section through the post-central gyrus. And what they've labeled here are the different parts of the body that respond or that activate neurons in these regions of the brain when they are stimulated. So, like let's say right here, this region right here is part of the somatosensory cortex, and if one were to put an electrode into this part of the brain right here, and then touch the elbow, specifically the right elbow, because we're on the left side of the brain, so this would be inputs from the right side of the body. If you were to touch the right elbow while having an electrode in this region, that would activate these neurons, whereas if you were to touch some other part of the body, it would not give you a response. So that's what that map represents. And the reason we say it's somatotopic is that the parts of the body that are next to each other are also represented by parts of cortex that are next to each other. So the part of the cortex that represents the elbow is right next to the part of the cortex that represents the arm, and then that's next to the part that represents the head and the neck and the trunk and so on. So the entire body is represented on each side. So the entire right side of the body is represented on the left side and vice versa. And those regions are next to each other. So that's true for pretty much everything except for the genitals and then the face. So the face is represented mostly down here on the kind of lateral and to some extent the inferior surface of the post-central gyrus. But still within that region you have somatotopy. So the eye is right next to the area. The area of skin around the eye is represented in this part of the cortex, which is represented by, or right next to the area of cortex that responds to the nose, which is right next to the area that responds to the lips, and so on. So that's what this map is for. Now, of course, it's not a perfect representation. So we already said, for example, the face is not where you would expect it to be, because the head, the back of the head, and the back of the neck is up here, on the superior side of the cortex, but the face is down here. But that's probably just due to the fact that the touch receptors from the face enter from a different pathway than the one they come in through the trigeminal pathway, as opposed to the spinal nerves, which is where all the other touch receptors come in from. And then the other thing that you may notice is that the area of cortex representing different parts of the body are not proportional to their actual size. So the region of the cortex that represents the face, for example, is this entire region. So this whole area of somatosensory cortex represents the face, whereas let's say this region up here, the trunk and the hips and the back, is represented by a much tinier proportion of somatosensory cortex. So it's not representative in terms of size, even though it may be representative in terms of position. And in fact, this little guy is what you would look like if your body actually was proportional to how it's represented in the primary somatosensory cortex. In fact, this is called the somatosensory homunculus. And so what you can see is some parts of the body, like especially the hands, the lips, and the tongue, are way overrepresented. Now, in a direct sense, that's because of different degrees of sensitivity. So the hands and the lips and the tongue have much more sensitive touch receptors, much more densely packed touch receptors. So you have much more resolution in those parts of the body. By the way, this is, of course, a male homunculus. For whatever reason, they're presumably the homunculus of a female would look the same, but it's always represented as a male. Then if you look at the homunculus of other animals, or the somatosensory cortex of other animals, it's not the same. So again, for humans, the hands and the lips and the tongue are highly overrepresented. But if you look in, say, a monkey, the hands and feet both have kind of the same representation. The face also is overrepresented, but the tongue is not nearly as overrepresented. And then if you look in rabbits and cats, rabbits have very teeny tiny representation of their feet compared to the actual size, whereas the teeth and the snout and the whiskers are very much highly represented. Whereas in cats, meanwhile, again, face, especially the whiskers, is overrepresented, but they do have a lot of representation of the paws. So there's a lot of variation, and the variation probably reflects how we use those parts of the body. So monkeys, for example, they use both their hands and their feet to climb. So that's probably the reason why their front and back hands or feet both have the same degree of representation, because they sort of use them in the same way. Rabbits, meanwhile, they don't really use their feet so much as sensory organs. They're really just there for moving. So they don't need a lot of representation, whereas they use their whiskers and their teeth and their jaws to feel with, to feel textures. Same way with cats, but then cats, because they climb and they have to have a lot more dexterity, their paws seem to be overrepresented. Humans, meanwhile, our hands, for example, are way more represented than our feet, and that's probably because we use our hands a lot more, again, as sensory organs. So we use them to feel shapes and textures. We use our hands to manipulate tools, and so on. So that's probably why the human hand is so much more represented than the feet. Now, another question, though, is why are the lips and tongue so highly represented in humans? And to answer that question, you would have to ask, what do humans use their lips and tongues for that other animals don't? And one thing is the thing I'm doing right now, which is speaking. So speech is probably one of the reasons why humans have a lot of sensory innervation in the lips and tongue, and therefore why the brain in turn has a lot of real estate devoted to processing sensory input from that area. Now, on the other hand, there's other things we do with our lips and tongue that other animals don't. Kissing comes to mind. Now, we are the only animals that really kiss, and so it's possible that one of those things evolved before the other. So, in other words, one hypothesis is that we evolved this representation of the lips and tongue as a consequence of speech. So in other words, we evolved speech, and so we evolved this representation as a consequence of that. But it could have happened the other way around. It could have been that we evolved this large sensitivity of the lips and tongue first for some other reason, and that speech came along and for other reasons later. And so, in fact, it's just as likely that perhaps we evolved kissing first as a social interaction, and that the ability to speak just sort of came along as a bonus. But in any case, that's one of the reasons why the lips and tongue are represented that way. And again, you shouldn't be surprised that there's that degree of sensitivity in the lips and tongue. If you've ever watched a baby try to play with toys or explore objects, the first thing they do is, as soon as they're able to grab things with their hands, they shove them right in their mouth. So that's one of the first parts of the body to develop in the brain, and so that's another way in which we use the mouth and tongue. Is we actually use our lips as a somatosensory receptor structure. But anyway, that's just an interesting little trait of the somatosensory cortex. Another important property of somatosensory cortex, which is actually a property of all cortical regions, and to some extent is a property of all parts of the brain and the nervous system generally, is plasticity. So when we talk about plasticity, what we really mean is flexibility. So plastic, or something that's plastic, is flexible or changeable. So when we talk about cortical plasticity, what we mean is the ability of a given region of cortex to change its connectivity, and therefore change the way it's mapped out as a result of some sort of activity or experience. So again, this happens all over the brain for lots of reasons, but it's especially prominent in the somatosensory cortex. And there's lots of ways to demonstrate this. This is just an example of an experiment where they're looking at the somatosensory cortex in monkey brains that represent the fingers. So this is, here they're on the right side of the brain, and so this is the equivalent of this primary somatosensory cortex in the monkey brain, and this region is the part of somatosensory cortex that represents the fingers. So for each finger, there's a region of somatosensory cortex that represents that digit. So D1 here is the part of cortex that represents digit 1, specifically the palmar surface. So that's the side on the palm, and then to some extent also the dorsal surface. And then D2 is the region that corresponds to digit 2, and so on. And again, they're all arranged in a nice somatotopic map, all in the same order that they're found in on the fingers. And then in this experiment, what they did is they actually surgically removed one of the fingers. So digit 3, they just, while the monkey was anesthetized, surgically removed it, and then went back later and mapped this region again. So the way you map a part of somatosensory cortex, like I said before, you stick an electrode into this part of the brain, and then you touch that area of skin to see where it responds. So in this case, if you stick an electrode right here and then touch the palmar surface of digit 3, you will see activity in that region. So the question is, if you remove digit 3, what happens to those neurons? The neurons themselves presumably are still there, but they're not getting any input from digit 3. So if you come back later and record from that same area, what will you see? Will they just not respond to anything? And what it turns out is that after a while, so you have to wait a few days or weeks, but if you come back and record from that same region, so in other words, you're recording from, this is the part of the brain that responds to digit 3. Again, now you're recording from that same region, so here, but now again, digit 3 is gone, so touching digit 3 won't do anything because it's not there. But if you record from those same neurons, what you would find is that now they respond when you touch digit 4 or digit 2. So essentially what that means is the representation of digit 4 and digit 2 has expanded to cover what used to be digit 3. And so that's a rearrangement of the connections within that part of the brain. So that's an example of plasticity. Hopefully at some point we'll get to talk about synaptic strength and synaptic rearrangements, but again, this happens in the brain all the time. Anytime any sort of change occurs due to experience, it's some form of plasticity. This is a similar experiment, a little bit less violent, where instead of removing a finger or removing input to one of the digits, they kind of increased the amount of stimulus or sensation to those digits. So here what they've done is they've trained the monkey to touch this disc, and it's just like a little disc that has little grooves on it, and you can teach monkeys to do stuff like this pretty easily. Basically, in this case, they've trained the monkey to only touch the disc with these two fingers, so just with digits 2 and 3. And again, you can train monkeys this way. Just anytime they touch the disc with the correct fingers, they get a treat, and they learn to do this pretty fast. And then they'll do this over and over again as long as they keep getting rewards. And then over time, if you go back and record from the this part of the brain that gets input from these fingers, now they've only been using digit 2 and 3, and they've been using digit 2 and 3 together. Whereas the other digits are used a lot less. And what you can show is that the representation of digits 2 and 3 have both expanded into the regions that used to respond to digits 1 and 4. So just another example of plasticity. You can see this in humans too. So anytime you use some part of your brain a lot at the expense of some other part, you might see plasticity. For example, people that play musical instruments, especially sort of asymmetrically used instruments like, say, a violin, where one hand, if you play a violin, your left hand usually you're fingering strings, and your right hand you're moving the bow. So you're using your hands in much different ways, or your fingers in a lot of different ways. And if you look at the brain of someone who's played violin for years and years and years, you'll see that the representation of the left hand and the left fingers is larger than the representation of the right hand and the right fingers, just because they've done that those movements and used their fingers like that so much and for so long. Now, so that's the primary somatosensory cortex, and just like with the auditory and visual cortical regions, there are secondary and tertiary cortical, sensory cortical areas that get their input from primary somatosensory cortex. One of the most important regions for the somatosensory system is this area called the posterior parietal cortex. So that means just the region of cortex that's posterior to the central sulcus and still part of the parietal lobe. So remember that this whole area is parietal lobe, and then back here is occipital lobe. So posterior parietal cortex happens to correspond to Brodmann areas 5 and 7. And these regions are situated, you can kind of see, in the center of a lot of other sensory areas. So back here you have the visual cortex, down here you have auditory cortex, and then the somatosensory cortex is right here. So it's sort of surrounded by all these other sensory regions. So one of its jobs seems to be integrating somatosensory input with from all those different modalities. And so its role seems to be in kind of combining those together to create your perception of your body and the way your body is oriented in space. And the way we know that is from what happens if this area gets damaged. So in people who have suffered damage to one side of the posterior parietal area, they have this kind of interesting effect called hemispatial neglect syndrome. So it's not simply a matter of loss of sensation, because you can give them tasks like, say, to draw a picture. So here, someone with this condition was given the task of copying these pictures. So they got a picture of a clock, or a picture of a house, or a picture of a flower, and the doctor said, okay, copy this picture. And so patients with this syndrome might try to draw a clock by maybe drawing a circle, maybe drawing the hands, but then only drawing numbers on one side of the clock. So, here just going from like 2 to 7. Drawing the house, they can do the roof and the ground, the doors and the wall on one side, but then the doors and the wall on the other side are just gone. The picture of the flower, they can draw the stem and the leaves, but then the petals only show up on the right side, not the left side. Over here, this is spontaneous drawing, so they here the task was just draw a face. So they did pretty good. They got the outline of the face, the nose, the mouth, the ears, but then the eye just is gone. There's just no eye there. And here the task was draw a clock. So again, they got a circle. They didn't draw the hands at all, and they actually wrote out all the numbers, although not really in order, and all bunched together on the right side. And it's not just so this kind of condition doesn't just lead to this kind of deficit, trouble with drawing or copying. People with hemispatial neglect syndrome will pretty much neglect everything on that side of the body. By the way, remember, everything's flipped. So if the hemispatial neglect is for the left side, which is what these pictures represent, then the brain damage would have been on the right side. In fact, that it's usually damage to the right side that causes this condition. It can happen on the left side too, but it's not just drawing. So people, men, for example, with hemispatial neglect syndrome will only shave one side of their face. So they'll only shave the right side and leave the left side hairy. Women that wear makeup will only put makeup on the right side, not the other. Sometimes people will, as they try to put on clothes, will only put on their clothes on one side of the body and not the other. One sock and one shoe. If they try to eat a plate of food, they might only eat the food from one side of the plate. And it's not simply a lack of sensory awareness. So it's not that they can't see or feel that side of their body, because of course if you were simply blind on the left side of your visual field, you could just turn your head and see everything else, or turn your eyes. But people with this condition are not just blind or lacking sensory input. They're just unaware of sort of the left side of the universe. Just sort of the leftness of things is missing. Here's an example. This is a dog that has had brain damage that shows symptoms that kind of look like this. So here the dog is trying to eat from its bowl, but it's only able to eat from in this case the right side of the bowl. Actually, the image could have been flipped. So clearly the dog is still hungry, can perhaps maybe even smell food in there, but simply can't comprehend the fact that there's a left side to that bowl. And so again, that's an example of hemispatial neglect. So again, presumably if it was just a matter of difficulty seeing, then when the dog sort of looked at the bowl the right way, it would see that there's food over there and try to eat it. But it's not a simple matter of sensory awareness. So that's just a strong example of how the brain processes sensory information. Your brain, again, it's not a computer. It's not just recording information and storing it on a hard drive somewhere. It has to take all the sensory information from the different sensory systems and combine it into sort of a unified whole. So it's your perception of yourself and your position and location in space and location of things around you all kind of come together And at least the parietal lobe seems to be an important part of that process. And next time we will talk about pain.